medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Heart failure is when your heart muscles are either too weak or not elastic enough to pump blood properly. And it's about 6.2 million people in the United States that are living with heart failure. Now, this can result in endogenous defects within the cardiomyocytes themselves or something that's causing demand on the heart. The intrinsic factors of genetic diseases or hypertrophic cardiomyopathy being that example. And then there are external factors that lead to heart failure, which is infarction, high blood pressure, metabolic disorders, and hormonal disorders, including hypothyroidism and hyperthyroidism. So this stress changes things at a molecular cellular level. And despite a lot of the progress in the Western medical model, it is one of the leading causes of mortality and one of the number one admissions to a hospital over the age of 40. The symptoms can develop slowly and becomes something that's very slow and you need to look for it. Some of these are basically shortness of breath with lying down, fatigue, swelling in the legs, rapid heart rate, a reduced ability to exercise, wheezing, a cough that doesn't go away or brings up white or even pink mucus with some blood in it, swelling in the abdomen, rapid weight gain, nausea, lack of appetite, decreased alertness, and even chest pain if a heart attack is the cause of this. Now, separated into the two sides, the ventricular sides, the left-sided heart failure is typically trouble breathing, shortness of breath, coughing, especially with exertion, shortness of breath when lying down and sleeping on extra pillows. As opposed to the right-sided heart failure, which is typically palpitations, chest discomfort, shortness of breath, fluid retention, especially in the lower part of the body, and weight gain. Now, you don't have to know the right from the left. You can certainly always look it up, but at least be able to recognize that as an aggregate, these could be signs of heart failure, and you should be aware of it. The reason why is, number one, because of its consequences, but number two, there's so much that can be done in our integrative model approach, meaning things like nutraceuticals, etc. And that's where we're going to go with the next one that we do. Will be about lab testing and also then talk about nutraceuticals that can really help a patient, not a little, significantly. You're going to really like this. For any information prior to the next version of this particular program, just call Dr. or write to drmitchghen.com. That's DrMitchGhen.com. See you next week.